Good morning, everyone. I'm Dr. Thej, Professor of Pathology, BGS Global Institute of Medical Sciences, consultant pathologist at Shanti Hospital and Research Center and Cura Hospitals. I thank LACNAR, which is a health professional placement app, for starting this initiative of creating some videos for doctors, which will be help them in their daily practice as well as the legal aspects of practice. So coming to pathology, I would just deviate by taking my journey, which started around 12 years. The day I joined my PG course, my professor over there mentioned about what is it to take pathology as a subject to study. So he told me usually patients come to doctors for getting them diagnosed. And what do doctors do? Doctors will send their patient samples to pathologist. So what is a pathologist finally? A doctor's doctor. So that is the sense of responsibility a pathologist should have on treating patients, and our responsibility towards the patient depends on what quality of reports we issue and what is the quality of those reports, which is going to help the clinical decisions that our clinicians and other doctors are going to make based on those reports, and how it is going to finally help the patients. Because finally we are in the field where the patients are our ultimate target. This is what we have to target at. Our patient benefit and our patient well-being is our top priority. So for this, as the whole world, the whole medical fraternity has been depending on one concept of evidence-based medicine. So we are, as pathologists, as laboratory medicine professionals, we stand in the crux of the evidence-based medicine setup, where whatever evidence we are giving is what the clinicians are going to use. So our primary target or goal would be on how to see the look at the quality and the quality of the evidence that we give, which is going to affect the patient treatment. So evidence-based medicine being very important is the top priority presently, and based on this, there are certain aspects where a pathologist or a laboratory professional has to be very careful about. That is about quality assurance. So how do we ensure that there is quality assurance which is being delivered to the patient? So one aspect being quality assurance, the other being the legal aspect. Since we are giving out a report or we are giving out a document with our name signed over it, with the lab values of the patient or the party concerned, we need to be very specific about what we are going to mention over there, and it has to be helpful for the patient community. So for taking up the topic of quality assurance, see, the quality assurance, or to maintain the quality of the reports given, there is one important dictum for all pathologists or laboratory professionals. The report can only be as good as the specimen. A wrong specimen will give rise to a wrong report. A wrong report will change the complete clinical course of a patient. So ensuring that a specimen is of the correct type for the correct test mentioned with the correct details mentioned is of top priority. So this comes under the pre-test variables that can vary. So as laboratory professionals, as administrators who can manage the people who work under us, like lab technicians or nurses, a proper orientation to our allied health science workers is of top priority, wherein we instruct them on how to collect the samples, how to name the samples, how to send the samples properly in the right environmental conditions to the lab for testing is of very, very high importance. This is one part which we neglect a little bit in most of the healthcare institutions. So we have to set up a plan where we prepare a proper training schedule for every new entrant in the allied health science working community to teach them on how to handle specimens, how to collect specimens. This is of very, very, very high importance. If this one thing is covered, this itself cuts down the type of errors that can happen. Just for an example, if a patient is already being infused with fluids, we'll take as an example of a DNS. Now, if a staff nurse who is working on that patient collects a sample and then thinks anyway the patient has been pricked once, why prick him again, and collects a blood sample right from the vein where the fluid is being transfused and sends it for an analysis of a hemoglobin, just the dilutional effect of that fluid entering in the blood will create a wrong impression by giving a wrong hemoglobin value, just for the dilutional effect. If DNS is being given and the patient's blood sugar is being checked from the same sample, we'll give an artificially high sample. These are the routine things that we face in regular practice. So this creates a situation where training of our allied health workers is of high importance. And this is just one of the examples on how things can go wrong. Next is the testing part, where we come to the part where the sample has reached the lab. And here our high dependency on machinery has made it very, very important for us to maintain the machines equally well. With funding, with new funding coming in, and with institutions understanding that we are in a world of evidence-based medicine, and the laboratory testing is a very, very important category in the patient treatment, the machines that are being procured are of top quality. But maintaining them, how do we maintain them? How do we periodically check them whether they're giving out proper values or not? What is the calibration certificates that we require for each instrument to be maintained? So these are the things that as laboratory physicians we have to concentrate on for maintaining the proper quality of the reports that are issued by us. So machine maintenance, man management of our technicians, proper sample collection, these two parts, that is the pre-test and the testing part of error management, constitutes most of the errors that occur in the laboratory setup. So the next part is the post-testing part, which is the how you type the reports, or how you send out the reports. Does the report reach the right patient? So these are things that do occur, problems do occur in this one. This has been minimized to a large extent by combining the machines with the computers. The computers take up the reports directly from the machines. So these post-test errors have come down significantly. Coming to this one, we would not expect a 6 sigma rating for every this one, where 6 sigma means 3 mistakes per every million or every 10 lakh reports that we do. We don't need to achieve 6 sigma. We want to achieve something close by, where the patients will trust us with their reports. Because even for that matter, if I go in as a patient, forget I'm a doctor, if I go in as a patient, if my child's report is coming out, I should have some assurance that those reports are correct. So it is the responsibility of the laboratory physician, a pathologist, a biochemist, a microbiologist, to ensure that the pre-test, that the sample collection was good, the testing was good, as well as the reporting was good. This is the responsibility of us as laboratory physicians to ensure, because there's a lot of dependency now on the reports for treatment, because it is evidence-based medicine. On a very down note, I would tell that the reliance on the clinical examination has come down with increase in reliance on lab reports, which is good, evidence-based medicine, but still this makes us even more to be even more careful about how we report our samples. Like Edward Deming said, "In God we trust without any proof, but rest everybody must bring data." So that data is what we give to the patients for their treatment. So this is where we can limit our mistakes. So this series of videos would concentrate on each of these, on how to individually do them, how to avoid the pre-test errors, how to avoid the testing errors, how to avoid the post-test errors, what are the other features or the factors that affect our testing, which would finally lead to a good report coming out to a patient. This is, I as a pathologist, in my field of study, is very, very important. The same now is also being taught to students on how to avoid these errors, on how to go about. My personal suggestion even to the practicing physicians are, mistakes do happen. Mistakes are bound to happen. It is inevitable that they will happen. We put our maximum effort to limit those errors to the least possible. We would definitely, in my this one, I want to achieve a 6 sigma effect, where there's only a 3 error rate per million tests that I do. I would definitely want to achieve that. I would want all the laboratory physicians to achieve such a minimal error rate, but the clinicians will have to start trusting the doctors to whom they send the reports to, because without that trust we cannot run the system. So that trust plays a very important factor. When something is wrong or something is not matching with the test report, the best solution would be to call up the pathologist or call up the biochemist to ask them, okay, we don't see that the reports are matching to the patient profile. So would we want to do some other test? Would we want to, based on these tests, do another reflex testing? Choose some other test which would give a better view. with an open mind, saying that even our clinical diagnosis can be wrong. Maybe the laboratory values are giving out a better report. Just for an example, when I'm checking for platelets on a slide, I would definitely rely more on the machine, because the machine is testing higher number of cells, counting higher number of cells, except for some exceptional conditions where it is not testing the or counting the cells properly. A machine is now being trained with such advancement in machine technology. The machine is very, very good at testing. So doubting the machine might be not in our favor. So we have to work in tune, in coordination with the clinicians, to give the best possible report or best possible result for the patient. The other things are about the series would also cover on some aspects about how some laboratory setups are being run by unauthorized people, are being run on a very shady way, in which it won't benefit the patient. As I told you, I'm repeating the same thing again and again. Patient care and the best possible patient care is our ulterior motive. Our profession depends on the best possible care we can give to our patients. So we need to control, as doctors, we need to be careful on how the tests were done, in which lab it was done, whether the lab had a pathologist or a biochemist to overview or oversee the procedural aspects of the machine, or the test sample collection, or the testing part. So this becomes very important. Governments have taken initiative to see to it that people don't misuse the laboratory physician concept, where it is a highly monetary based business. So many people who are not in this profession have entered into the setup, which is acceptable as an entrepreneur, but with it has to be with sound medical basis. So simple, this one would be a doctor or a pathologist or a laboratory physician who visits such labs should see to it that the reports that are sent out are accurate, because it is finally who are responsible to the patients. It is not the business setup or the institution which is responsible. It is my name which is going to come out there as the pathologist. It is my responsibility to see to it that the patient gets the best benefit out of the report. We cannot push the blame on some other institution. So let us, as pathologists, as laboratory physicians, take this initiative to take it upon ourselves to see to it that the quality of reports that are issued under our name have the best possible outcome for the patient. So I again thank Lancar, which is a health professional placement app, for starting this series, wherein we will touch upon the other aspects mentioned in this video, so that we can elaborate and give the exact scenario on what is happening, how we can take steps to correct it if something is wrong, and as a finishing touch, to help our patients not in disease care but in health care. What we are presently doing has become disease care. We want to shift over to health care, where we would want to give proper reports helping the patients to prevent further diseases. So prevention is more important. Thank you, Lan.